So I'm going to introduce Dr. Elizabeth Nesmith tonight, or this afternoon. And Beth comes to us from the School of Nursing at Augusta University, and she is, I have to read this, the chair of the Department of Physiological and Technological Nursing, and she's an associate professor at Augusta University. So I don't know how long that department's been in place, but I bet you're the founding department chair. So. Great, so welcome, Beth. Thank you.
So thank you all for letting me come and talk to you today. It's a privilege to come and address all of you in rural Georgia. We in the College of Nursing are excited about the partnerships and the initiatives that we have going. I'm going to tell you about a few of them today, some of which are funded, federally funded initiatives, and one of which we're seeking funding for. So I'm excited about that. My department, as Doug mentioned, is physiological and technological nursing. So it has a lot to do with technology, simulation, telehealth. The initiatives that we have going on have to do with incorporating those. And so a little bit about us. We are the University System of Georgia flagship public college of nursing in Georgia. We have campuses all over Georgia, in Augusta, in Athens, and we also have a presence on the Columbus State University campus. We have 4 degree granting and 4 advanced practice certificate programs. And we have almost 900 students, 500 of which are in graduate programs. So we are growing and large and expanding our reach every day. Also, interestingly, we are celebrating our 75th anniversary this year. We have lots of things going on. We'll have a big gala in March, and we hope to share that impact that we've had over these last 75 years with you all. Hope you'll join us in March for that. We have some signature projects that we have going on. We manage a behavioral health hospital in Augusta, East Central Regional Hospital, by providing the nursing care there and hiring and all of that going on at East Central. We have a healthy grandparents program whereby we support grandparents who are rearing their grandchildren. A lot of support going on with that, so we're trying to help and support those individuals doing those things. We also have a presence at the Costa Lehman Health Fair. That is a health fair where we provide screening services in collaboration with our other clinician colleagues for migrant health workers who come from all over, generally mostly Mexico, to rural South Carolina. That is a large project that we do and support, and that has both clinical services and research services. Our dean founded the Greater Augusta Healthcare Network, and we go to Peru with our faculty and students to provide women's health care screening and services to the natives in those mountain areas. And then we also have a Healthy Start initiative, which I'll talk about in a few minutes. So on the agenda before 1:30 today, I'm going to talk about that Healthy Start, which is a HRSA-funded service, headed by Dr. Sandra Inglett. Also, 2 newly funded projects, which are the IMPACT, which is a primary care program, the behavioral health program funded by HRSA also, and then a neat research and clinical partnership funded by the Patient-Centered Outcomes Research Institute, PCORI. And lastly, the project that I'm really excited to talk about, which I lead, is the Nurse Practitioners in Emergency Providers project that we are trying to get funding for. So quickly, the Enterprise Community Healthy Start is a HRSA grant funded project for $750,000 a year over 5 years, in which we aim to reduce infant mortality and low birth weight outcomes in infants. The catchment area is rural in Burke and McDuffie counties around Augusta, and we case manage with our nursing services approximately right now 450 high-risk women and their families. This is a very stable program that has been continuously funded since 1999, and we are seeking to improve women's health care both before, during, and after pregnancy. Through this program, we promote quality services and the family resilience model to achieve collective impact. So this is a terrific program, again, led by our own Dr. Sandra Inglett, where she is collaborating with providers in those rural counties to improve those outcomes. It has considerable challenges, though, some of which include things that you're familiar with, things like lack of accessible, and affordable care, OB services, specialty expertise, dental services in these counties. We also, interestingly, we were just talking about this last night at a roundtable, informal roundtable we had. Risk factors for prenatal patients include kind of later entry to OB prenatal care, and some of those things are behavioral also, things like depression among these young mothers. And then they have obesity, maybe asthma, increased number of sexually transmitted diseases that kind of add on to that vulnerability. Also included with that are those things that we know of as social determinants of health, which include lack of income, lack of transportation, low health literacy, difficulty navigating access to some of these places. So this program aims to really try to meet those challenges and help them. And like I said, it's been successful since it's been in since 1999, and we are very proud and happy to be involved in it. Some of the future opportunities that we seek to expand with this program include an increased focus on preventive care for these individuals, and then also, importantly, to ensure that all the individuals, all the professionals practice at the top of their license. And you might think, that's intuitive, why aren't, I mean, they do that anyway, but really, they don't. What used to be called the Institute of Medicine Future of Nursing report, about 8 years ago, one of their statements were that, in particular, nurse practitioners should be practicing at the top of their license. The things that they were educated to do, the things that they were trained to do, the things that evidence shows that they are better at, or at least as good at, they should have the opportunity to practice at that level. And they're not doing that all over Georgia. That's what some of these initiatives that we're talking about aim to bring into rural healthcare to really maximize some of those outcomes. This program is a future opportunity to do that, as are the others I'm going to talk about. We also want to train advanced practice registered nurses, APRNs, for telemethods of delivery. That's where the technology piece comes in. And that's where there's tremendous opportunities for connecting those hub centers with the spokes to really provide those consultative services that fill the gap for individuals where access of care is concerned. And then also where this particular program is concerned, we want to design and provide innovative pregnancy programs such as centering. And the individuals that are working with this project work together to provide the research and the practice to do those kinds of things. So that is our Healthy Start initiative. The next one I'm going to talk about, these two next programs, again, I mentioned were most recently federally funded through the Health Resources and Services Administration Advanced Nursing Education and Workforce Program. This funding period was just this summer and lasts through 2019. Funding amount was more than $1 million. So they put their trust in us to create, lead, and implement this program in Georgia. And it aims to put doctoral level family nurse practitioner students in the rural environment. Now, for some of you might not be as familiar with what I mean by doctoral level. Now, used to, for years, there used to be the only doctoral level degree for nurses was the PhD degree, that which most of us are familiar with, where nurses do nursing research to improve nursing practice and discover new knowledge which improves nursing outcomes. Now, like physical therapy, like pharmacists, like other health providers, we have a practice level doctorate. That is, individuals, advanced practice nurses are trained at the doctoral level, like our physician colleagues, our dental colleagues, that all provide education and training at that level. So that's different, and we are aiming to bring those individuals now. This DNP, since 2015, is the entry level of practice for nurse practitioners now, whereas it used to be the master's level. So now the nurse practitioners that are seeing you and that you are utilizing in your areas should be doctorally prepared. We have formalized partner organizations like MedLink Georgia, Community Healthcare Systems, and Medical Associates Plus. So as I mentioned, the mission of this project is to bring those primary care nurse practitioners into the rural settings to increase both the education and clinical partnerships with these, with our colleagues and to provide care for vulnerable populations. And we also, it helps to bring these DMP, FNP graduates with the knowledge and skills into these areas. Interestingly, it's led by a project advisory board. So we are all about, you know, I mentioned the PhD in nursing and the research that drives our nursing practice. One of the things that we and our other clinical colleagues do as a research method is community-based participatory research. And that is, you ask the community what they need the most, because we can't assume, we don't presume to know, because we're not from, many of us, those of us who aren't from the rural communities can't make those assumptions. So you go and ask the individuals what they need. They provide us the project advisory board to make this thing work. And those projects that are led and advised by a community advisory board are often the ones that are most successful. And we think that's one of the reasons that HRSA put their trust in us to implement this project. So the goals are really to create formalized academic practice partnerships. Many of those partnerships are throughout the state and are more informal. The one like we have with Phoebe here with Augusta University, this one would formalize some of those practice partnerships and advance the DNP, FNP, Family Nurse Practitioner curriculum in teaching and learning to put those best practices and the things that evidence shows we do best in the rural setting. We want to prepare students for primary care delivery to rural and medically underserved populations and enhance, most important, well, very importantly, the preceptor pool, because we have difficulty in our urban settings finding clinical spots for training for family nurse practitioners. I know that that happens with other practitioners as well, and so this provides a way for us to do that. And the cool thing is that it happens in the rural setting so that those individuals are training, learning, loving those rural settings, and they want to stay there. I think one of our earlier speakers mentioned a similar partnership with our physician colleagues, whereas at least two of those individuals want to stay in that environment, and this program would also do that. The next one, we've had several of our speakers mention today and some earlier in the week at a rural health symposium at Berry College in Rome, the importance of behavioral health. Nurse practitioners provide great help with that also, and this program was HRSA funded most recently, just September 30th this year, for more than $1.5 million. So similarly, HRSA put their trust in us to administer this program. This one is led by Dr. Daryl Thompson, who is both a family nurse practitioner and an acute care nurse practitioner. And so he brings his expertise to this program, which is really neat because it's interprofessional. We work interprofessionally, we should train interprofessionally. So this program provides a way to do that, not only with our physician colleagues, but also those licensed clinical social workers who provide behavioral health services also in mental health. So as I mentioned, the mission of this program is to bring behavioral health services to rural areas, and again, to produce those psychiatrists, psychiatric mental health nurse practitioners, and licensed counselors who are flexible to work in these settings. We use a collaborative care model. Like I said, we work together, we should train together, and this makes use of that. We also, importantly, the theme here is making use of that technology for the telemed and the telehealth psychiatry. That has been proven in the literature, supported in the literature, to help improve behavioral health outcomes as well. And so we want to implement that and utilize the skills and abilities of these practitioners through the telehealth technology to broaden that access to individuals in the underserved areas. And also, as I mentioned, to importantly increase the number of professionals who are situated in those areas, who not just helicopter in, as they say, come and leave, but stay in those rural areas, which strengthens the healthcare that's there. So those three projects were practice-based that I mentioned. This one is really neat because it serves to develop new knowledge which supports the practice that we are trying to implement. This is the one that I was talking about that is funded by the Patient-Centered Outcomes Research Institute, and is led by the program director in our PhD program, in our PhD nursing program. It also uses the community-based advisory groups to ask questions and research questions that are most important to the groups here. If you don't match what you're doing to the community and that what they feel like their needs are, it'll never be successful. And so this project was funded for 2 phases to provide a collaborative group of patients and stakeholders who generate questions based on what their needs are, research questions. And then the second phase is for researchers to develop a group to actually research these questions and make proposals for practice that will help, that are well matched and will help improve outcomes. To date, we've got 2 projects right now going on. The individuals in our community advisory board said that school-age children with behavioral health needs is important to us. I think some of those projects are going on through some of our telehealth and school-based health centers that I heard earlier at Berry College this week. With this, we want to compare the advanced practice registered nurse healthcare model using telehealth services with standard healthcare through this research, the standard healthcare being the primary care physician practice model. We want to see which one is a better match and works for the individuals in these communities, because different models might work in different areas. We have the knowledge, skills, and ability to provide these services, and we want to test it and see if it works for the community who has said that this is important to them. The other question had to do with diabetes. So in individuals with type 2 diabetes, does it work for advanced practice registered nurses to provide chronic healthcare model using, again, telehealth, compared also as another option with the traditional standard physician healthcare model? So again, importance thinking outside the box, thinking about other models that also work for individuals to improve access and outcomes. And so we are testing those models raised by the community to see if they work. Again, the evidence does say that outcomes are as good as better or better with advanced practice registered nurses, and we want to test them in as many environments as we can. So that's that one. And then the future opportunity with this one in particular is nonprofit organization and academic institution partnerships, as we have talked about. They're ideal for engaging patients and stakeholders in meaningful research projects in rural communities. Because again, we can practice, but we've got to test these new ideas and see if they're worth going, to see if they work from a outcomes perspective, from a quality perspective. We were talking over lunch about if you don't have quality, nothing else matters. So if they work from that perspective, and then from an economics perspective also. Because, really importantly here, because I used to be the program director for our PhD program, and now I have individuals in my department, we need more rural healthcare research. It's easier, it's an easier path for the individuals situated in academic medical centers to do their research right there where they are, steps away from where they are, because it's convenient. That means that rural hospitals and other places that are a little bit harder to get to kind of get the shaft a little bit, and we need to have researchers and practitioners situated in these environments to help test some of these new projects to see if they work. And this program provides for that, I'm excited to say. All right, so here's the one. We talked about 4 other projects that are already funded. HRSA has put their trust in us to implement those projects. Here's another one that we feel pretty strongly about, and I personally feel strongly about, because Doug told you that I am an emergency and trauma nurse who has taken care of a lot of these folks who, when I was still in Augusta, but when I was working in our trauma center, we had many individuals who had car crashes in rural areas, and they came to us, or we took care of, when I was an emergency room nurse, we had individuals who came to the emergency centers because they need emergency care in rural hospitals, something that you already know. This program is a collaboration between the Augusta University College of Nursing and the Medical College of Georgia and the Office of Rural Health here at Augusta University to bring nurse practitioners as emergency providers in there, because as you know, the rural hospitals in Georgia struggle to provide urgent and emergency care in particular. The other programs I talked about were primary care, behavioral health, which is also a need, but emergency and urgent care is an incredible need as well. Because also, those are not only take care of the patient's need, but they're also, the emergency room is also the entryway to your hospital, to the admits to your hospital, and that kind of thing. So you want individuals to come to your own hospital. As you also know, many emergency providers lack training, many providers lack training in urgent and emergency care, and they also lack effective and quick consultation with those individuals who do, because that consultation right now is inadequate, and we have a way through telehealth to improve that. And so we want to put that in this proposal to have that. Also, as you know, few providers who are trained in this area do not choose to stay in the rural area. So this proposal also addresses that. This is a collaborative training program whereby we would have an interprofessional partnership between the College of Nursing, I mentioned MCG, and the Office of Rural Health. We already have those partnerships. I've worked with individuals in emergency medicine my whole career. And we came together, we made a plan for this training. I talked about earlier, when we work together, we should train together. So this takes care of that. We would have postgraduate, doctorally prepared nurse practitioners training together side by side, the same program with emergency medicine residents. That not only shows that they have the same skill set in terms of their training, but importantly, it also develops that trust element. I think I was talking with someone earlier today, whereby the individuals that the nurse practitioners would later be consulting with trained beside that person, and so they trust that person, and they know that, okay, you know, I trained beside Jane or whatever, and she is now in Sandersville, and when she calls me, I know she knows what she's talking about, and I know that we are partners in this care for this individual. And so it creates that wonderful side-by-side, in the trenches teamwork that we enjoy in the emergency department and the critical care setting, and takes it out in the rural settings as well. And then this program, in addition to the side-by-side training and the training in emergency care, it would also train the individuals to utilize the telehealth and telemedicine technology. It's not that hard to do. At Berry College in Rome earlier in the week, we talked about nurse assistants or nursing assistants are doing that from the nursing homes. And so this would provide a comfortableness with an ease of equipment, would provide some of the equipment for these individuals to do that back and forth consultative services. So the citizens in the community could feel comfortable knowing that I've got a trained individual who, if needed, has instantaneous consultation with the folks at the larger hub hospital to make sure that my care is taken care of. So some of the benefits and costs to this program, the benefits, nurse practitioners would contracting the key word, to stay in the rural emergency care setting for at least 2 years. So of course there's a partnership, an equal partnership with the rural settings to make this happen where that's concerned. So we would only recruit individuals who would sign a contract to stay in the rural health setting. The estimated startup funding for one pilot site is about $260,000, and that's based on the salaries for the faculty who would do the training. It's based on the equipment that we would need to engage in the emergency department, because I know there's already some equipment in some of these counties, but we need it specific to emergency care. And it's based on the tuition for the postgraduate nursing practitioners who would be participating in the program. Estimated cost savings is about $500,000 annually, and that's based on where the nurse practitioners would work in these areas. It's the cost savings, the difference between the nurse practitioner salary and the physician salary. So we estimate that this program would be self-sustaining by year 3. So the saving, start up 260, you save money, that pays for the next year, and by the next year, it's self-sustaining. So that's really what we need to get this program started, is the support and the funding to get going and give this a try where emergency providers, nurse practitioners are in the emergency setting. So in summary, Augusta University College of Nursing, I hope I've demonstrated, is committed to providing advanced practice registered nurse education, research, and service to deliver healthcare all over Georgia, in our rural counties as well. And we are leading numerous initiatives which really do just that. We're focused on telehealth as Georgia's new frontier, and educating legislators and other policymakers about ways to overcome the barriers to advanced practice nurses so that they can indeed meet the initiatives of the Future of Nursing report and practice to the top of their license. So I appreciate your attention, and I've spoken with several of you maybe about following up on the NTEP initiative. I appreciate all of you as our hosts inviting us here, and thank you for your time.
Any questions for Dr. Nesmith, please?
Beth, on the last project that you mentioned, who provides the oversight for those nurse practitioners?
I wonder, maybe I just need to stand in front. It would be together. Myself, my department does that, and with my Medical College of Georgia colleagues, specifically Matt Lyon and Richard Schwartz, who work in emergency medicine. So together, we've already developed that training program. We've got the months that we would do it. We've got years that we would do it. We've got subject matter that we would do it together. And so collaboratively, there would be that oversight.
But like with the state, you have to have filed the protocol that the physician has agreed for the nurse practitioner for that oversight. So where does that come from?
Right.
Is it the local physicians or is it Augusta?
Right. You know, right now, most of that does work at the local level. We would provide support with that because we actually have an Office for Community Partnerships, which is doing that for many of our nurse practitioners who have practice agreements already. So we could provide support where that's concerned. You might know, however, that we are working with the legislature, and Senator Renee Underman, you guys mentioned who's going to be here, I think it's tomorrow.
Tomorrow night.
Yeah, is advocating legislation for nurse practitioners to have more independent practice. So that barrier might be out of the way before too long. Other questions?
You want to say anything about the connection that when they're in practice, the telehealth connection back to a simple emergency room where they're board certified emergency medicine?
Great point. So I don't think I explained as well the fact that this connection would include the hub telemedicine equipment being situated at Augusta University with a board-certified emergency physician so that the NPEP, the nurse practitioner in the emergency setting, would have quick consultation with a board-certified emergency medicine physician. So, great point. Thank you for mentioning that.
Not to take away, Beth, but
No, I'll give you this.
this is a model that's been used in Mississippi, or not this model, not what they've done. They've taken it to a whole different level in terms of the training and education of the nurse practitioner, the doctoral prepared nurse practitioner. So they've taken that to a different level in terms of the training, but they're still connecting back to a central source so that doctoral nurse practitioner, emergency room physician, I'm not even sure how, there's so many initials after that I'm afraid I can't get them all in. But there would be that connection. In Mississippi, they have a central core at the University of Mississippi, and the last time that I heard, and somebody may have additional information, there were 15 emergency rooms that were connected to this with nurse practitioners in those emergency rooms, either all day or part of the day. It's not an all or none phenomenon, obviously. It could be 12 and 12 or whatever it happens to be. But they have been very successful in this model there. And quite candidly, those nurses, although well prepared, Beth has taken it to a whole different level for the preparation of these folks in terms of their ability to practice independently. Sorry, I just wanted to draw that comparison and also that connection that would still occur.
And that's what teamwork's about, so thank you for adding that. Anything else? Okay, thank you for your time.
Thank you, Dan.